Hello, and thanks for joining us today. I would like to give you some important information on working with LGBTQ older adults. Many people are unaware of how large the older adult population really is. By the year 2030, the number of adults 65 and older will have increased dramatically, representing almost 20% of the US population. In fact, about 10,000 people born during the post-World War II baby boom turned 65 each day, and it's estimated that by 2030, between 2 to 6 million LGBTQ adults will be 65 years of age and older. Consider what this population has experienced during their lives. Being LGBTQ was criminalized and dangerous. In 1969, the Stonewall riots began the modern LGBTQ liberation movement, and society began to change. Some LGBTQ people were able to start living openly and finding community with others. However, there was still a great deal of rejection, and many people experienced losses of jobs, families, and housing because their LGBTQ identities were discovered or they chose to come out. As a result, some older folks will choose to keep their sexual orientation or gender identity from providers. This is understandable, as there were few legal protections during much of their lives, so disclosing identity due to stigma and discrimination may be frightening. Providers also may encounter individuals who came out later in life and need space to process grief and lost opportunities related to living so many years without the ability to be themselves. For instance, the discrimination and criminalization of LGBTQ identities cause severe barriers to marriage and family planning. Older LGBTQ individuals were often rejected from their families of origin at higher rates and experienced the loss of close friends and chosen family due to the AIDS epidemic. Behavioral health providers must consider the stigma and discrimination experienced by LGBTQ older adults that has led to health and well-being disparities. LGBTQ older adults are 2 times more likely to live alone, less likely to have a partner and children, and may be estranged from their families of origin. Often caretaking is done within a community of friends, also known as a chosen family, who are close in age and who are also aging with limited support. As a result, fears of aging alone and experiencing loneliness are common. Further, many who are not able to age in their homes fear being placed in the care of unsupportive caretakers or non-affirming skilled and assisted nursing facilities. This is especially true of older adults who identify as transgender. The experience of chronic medical conditions is similar to their cisgender and heterosexual counterparts, with a few exceptions. Overall, LGBTQ people experience poorer health and have challenges with multiple barriers to care, such as fear of discrimination, lack of affirming providers, and financial challenges. In behavioral health, it is critical to screen for anxiety, depression, and substance mismanagement, including alcohol, tobacco, and some prescription drugs. Finally, LGBTQ older adults are at higher risk for HIV and other sexually transmitted infections due to lack of condom use, postmenopausal changes, and reluctance to discuss sexual concerns. It is also important to note that 1/3 of LGBTQ older adults live in poverty, which may affect access to medical care or how often someone is able to go to the doctor. Often, negative health outcomes are also possible due to coping mechanisms used to manage the stress of discrimination and loneliness. Even through these incredible challenges, many older LGBTQ people are resilient and claim that surviving this difficult time has made them stronger and proud to share their rich lives and experiences with others. As a behavioral health provider, you can help support this resilience by affirming and celebrating your clients' authentic selves. Here are a few things you can do to help. 1. Affirm everyone's identity. Use the name and pronouns that they ask you to use. 2. Always ask how they identify, though LGBTQ older adults may not disclose their sexual orientation or gender identity information, even when we ask in a discreet and respectful manner. 3. Use an intersectional approach and recognize lived experience with discrimination in the behavioral healthcare system. Validate those experiences and stressors while working collaboratively with them to get the support they deserve. 4. Do not assume what someone's family or support system looks like. This means avoiding asking about whether someone has children or grandchildren to rely on. Instead, ask, who do you have in your life that provides support? Or, who do you spend time with? 5. Allow for longer appointment times to help build rapport and time to learn about the client's history and needs. 6. Practice patient-centered care. The patient is the expert in their own life and will be most successful when they are the driving force for their own healthcare plans, so it is important to have them clearly state their needs and wishes. Like many older people, LGBTQ folks may want to age in place. Connect them to social services that are affirming to older LGBTQ people. These may be more prevalent in large cities, but are available through the internet for those who are in more rural or less affirming parts of the country. For older LGBTQ people who are not able to age in place, inquire about whether the skilled and assisted nursing facilities are affirming. And if not, work to get your client into an affirming living situation. Healthcare providers who are allies to LGBTQ people can best help by advocating for their needs and by offering assistance to their families and systems of support.